I think, as most people are aware of, I did get infected with COVID in the spring, caring for patients early on in the pandemic. And, I got quite sick. I didn't end up hospitalized, but I was symptomatic for easily more than a month before I could return back to work. And I guess you could characterize me as one of these long haulers, meaning that I've continued to have symptoms up until present. There are days where I'm more fatigued than I feel like I should be. There's times where I walk up a flight of stairs and get short of breath and my heart's racing and I feel exhausted and very deconditioned. It's frustrating. It doesn't feel good. At my age, I want to feel like I'm healthy and physically fit and can run up a flight of stairs quickly if I have to. And sometimes I can't. So, look, this is an awful virus. This is terrible. You don't want to get it. I think what people don't realize is, even if you have a moderate case, maybe you don't end up in the hospital, but you're laid out sick with awful viral symptoms for a couple weeks. There's a good chance that 6 months from now, you're still not going to feel like yourself. You're going to feel like a different person. And you're probably not going to like it. You're probably going to wish that you never got this virus. So that'll be my message to everybody who is sort of tired of the precautions, is just let's keep it up until we can get vaccinated. I think, personally speaking, ever since I had this virus and I got sick, and now that I continue to have symptoms, there's another sense of duty, which is a bit of I owe this back to the world or to humanity, that I was fortunate I survived. It's like you go through that and you make it. You know that there are plenty of people who don't make it. You sort of have an extra sense of wanting to give back, and people give back in different ways. What are my skills? My skills are ICU skills. So how do I give back? I give back by working really, really hard and trying to figure out strategies to take care of these patients. Anybody who's able and fortunate enough to get their hands on a vaccine, get the vaccine, and I 100% will get it. Being one of the very frontline workers, I'm in one of the higher tiers, so that means that I'm most likely to be getting the vaccine shortly. Whether or not it helps you to think about this as something personal, and I'm worried about myself getting sick, whether it's helpful to think about this as, well, I'm worried about getting somebody else sick, so I'm more worried about doing my duty to, care for my fellow citizen, or whether it's more about respecting that there are nurses and respiratory therapists and people working in this hospital that are absolutely exhausted, and maybe somewhere you feel like those people deserve a little bit of a break. Well, then give them that break. My one wish for this season would be that we take a step back and we try to approach this problem by recognizing that we're only going to get through this okay if we abandon selfishness. If we think about each other and think about who might get sick, think about who might be overwhelmed with working in the hospital, think of all the businesses that have had to shut down and that's hurt their paycheck. Think about that as a motivation towards doing the right thing.